It means joint. Very little, if any, movement occurs here. And most arthroses are held together by fibrous tissue, so they're considered fibrous joints. You have the suture, which y'all know about, which you find in the skull. You have the gymphosis, which is the what? Tooth, okay, and the
alveolar process.
The alveolar process of the sockets. And a synchondrosis, which means together cartilage. Okay. So the suture, you can see here, dense fibrous connective tissue, very, very tough, very little flexibility and give, which is really good because you want it to be very strong. And that irregularity of those little bones that are attached together add even more strength. So you really are, that's really good to have that. Your gymphosis, you have a peg-shaped structure that fits into a socket, which would be the root of the tooth fitting down into the alveolar processes socket there. And that is the only example of a gymphosis. You okay, Ava?
Oh yeah, I'm just hot.
Hot?
I'm trying to cool off a little bit.
Yes,
Really good.
weird, 60-something degrees out there.
Do you get to see the papillomas?
I didn't actually. I have a lot of people out, and so I've been trying to
Get everything.
Yes, it's like a full-time job, you know.
Well, it was really good, I think.
I bet it was.
Yeah, it really was.
Yeah, the seniors were all
Y'all
We
excited.
tried
cheered.
really hard because it's seniors last month, so they were like, "We're gonna go out with a bang." I was like, "Oh my goodness."
The
Yeah,
cheering
they
team
were
was
like,
really
"Look,
good.
can we go
Yeah.
early? Can we?" I'm like, I don't think I can let you go too early, so I let them go like 3 minutes early. But they were all
Oh, everyone was
chomping at the
excited.
bits to get
Yeah.
out of here. Yeah. Okay, synchondra. What do we say that means?
Together cartilage.
Together cartilage. So obviously, it's a cartilaginous joint. Typically, we're looking at hyaline cartilage. And I mentioned yesterday, it is not a permanent type of joint because what happens over time?
Ossifies just
Yeah,
like
ossifies into a
epithelial
bone.
plate.
Right, that's right. Okay, so your epiphyseal plate is an example. You know that the bone growth eventually takes over the cartilage, and you wind up with an epiphyseal line, which is fusion of the bone, and you no longer have the cartilaginous plate. That cartilaginous connection between the sternum and the first vertebral sternal rib. Actually, ribs 2 through 7 are a little different because those are considered to be synovial joints. So it's just that first rib, okay? So this shows your epiphyseal plate, hyaline cartilage, and the hyaline cartilage in the ribs, and that first rib there. Okay, so your A&P arthrosis, these are what we consider to be slightly movable joints, okay? More so than the last ones. They're typically going to be either fibrous or they're going to be cartilaginous. There are 2 main types. Syn means what? Syn, together. Syn, S-Y-N. So together, and desmo refers to a ligament or a band. So these joints are held together by ligaments. Okay. So for example, remember the atlas and the axis? Do you remember the name of that ligament? Transverse ligament. Remember, it goes around the what?
The dens.
Dens, okay? And it allows you to make what movement?
Back and forth.
No.
Don't say back and forth.
No movement.
There you go.
No,
Yeah. Okay, also you have the sacroiliac joint. Where is that?
Probably your iliac.
And the ilium, and your iliac. The ilium, okay. So this is gonna be up here where the sacrum, which is part of, what part of the skeleton? Is that axial or appendicular?
Axial. No, axial.
Okay, what is the ilium?
That is
Appendicular.
Oh, so that would be a point where the lower appendicular and axial skeleton meet, right? Okay.
Like the clavicle and
Yeah, okay, good. All right, so
I remember that for the test.
that actually is where you,
Tyler?
Not mine.
Someone get kidnapped? It's not mine.
it could be, Miss Lawrence sometimes leaves a phone in here.
You have your ringer on or vibrating.
So you have lots of ligaments to hold that. As a matter of fact, that hormone relaxin relaxes those ligaments. And why would that be an advantage?
Because those
So you
ligaments
widen.
need to be relaxed for pregnancy.
Amen.
Labor.
But it actually helps you widen that pelvis, right? Okay. And then the distal tibiofibular joint. Where is that? Okay, so
Ankle.
Tibia
and your
fibula.
fibula.
right above the ankle,
Had
the
a
tibia and the
second.
fibula actually are held together by ligaments there too. Okay, so those are your, here's your, come here. Here is your distal tibiofibular. And of course, this is your transverse atlantal or transverse ligament, holding the dens in place in C1. And then here are your ligaments that are attached to your sacrum, the sacroiliac joint, and when they do relax, it definitely does make the hip bones a little wider and childbirth easier. Okay, next you have the symphysis. Where have you heard that?
Pubic symphysis.
Yes, very good. It literally means growing together, okay? So this is a cartilaginous joint, and you have the bones separated by pads of either, well, typically it's gonna be fibrocartilage. So you have the symphysis pubis, or the pubis symphysis. Like I said, these are interchangeable. Fibrocartilaginous disc there between the two pubic bones, and then of course you have the intervertebral disc, which the outside is actually made up of fibrocartilage. The inside is something different, and we'll talk about that later. And last but not least, we have the diarthrosis. What is di?
Two
Two. Arthro
joints.
joint. Okay, so you have your freely movable joints here. Most of your joints in your body are made up, are considered to be synovial or diarthrosis. Typically, you're going to find them at the ends of long bones. So think about your long bones. Are these long bones?
Yes.
Are these long bones?
Yes. Yes.
Your carpals.
No.
Metacarpal.
These.
No, metacarpal, yes.
Are these?
Yes.
Are these?
Yes.
Are these in your foot? And then your lower leg. Okay, so lots of joints there, right? And those are diarthrosis. You have more range of motion here. You have the presence of a synovial cavity and synovial joint, which is the fluid that fills the space. So a synovial joint, we have what we call a joint or articular capsule that surrounds a synovial cavity. And I'm going to show you the structure of this and the different structures that make it up. So you have a fibrous capsule, and that is actually continuous with the periosteum, that dense fibrous connective tissue that's around bone. So the fibers are interwoven, then they go around the joint, and then they interweave again into the periosteum in the bone with which it connects it. Let's see. You also have a synovial membrane, which is on the inner lining of the joint, and the synovial membrane actually is made up of cells that secrete a fluid that's kind of like the consistency of egg white, and that's known as synovial fluid, okay? Kind of thick and clear. So this kind of shows you just a generic synovial joint. I didn't mention enthesis, but that's just where your fibers from the capsule interweave into the periosteum. Of course, this will be the epiphyses, the ends of your long bones here coming together. And this would be what? It's gray.
Articular cartilage.
Articular cartilage. And actually, this kind of shows them touching, but they actually don't touch because there's a tiny amount of synovial fluid, this fluid stuff here, that actually separates that. Because if your cartilage actually touch, every time you move, what could happen?
Slip.
What could happen?
Rub the cartilage off.
You can rub the cartilage off. And that's what happens. People have to have, a lot of times, knee replacements or hip replacements. A lot of times that has worn the cartilage off, and you can actually, like I've seen surgeries where part of the bone, like the heads of the bones are missing, are half like worn off. You're like, how in the world did y'all stand this for that long? But people can do a lot. Okay, so here's your articular cartilage. This blue is your synovial. Well, there's synovial cavity, but in that is synovial fluid. We'll talk about a bursa here in a minute. Of course, tendon, you have muscles around here that are going to help support this joint. The tendons, again, kind of mix in at the enthesis here with those little fibers connecting to the periosteum, which adds great strength and stability. This purple is your joint capsule, and it is actually lined, like the dark purple here would actually be synovial fluid cell or synovial cells that secrete the synovial fluid. This just shows a ligament. Here again, you can see a ligament in enthesis where the fibers of the ligament intermingle with the periosteum, again, for really strength and all. We'll talk about a bursa later. Okay, so thinking about synovial fluid. Remember, this is the fluid that's in the joint. It helps kind of separate those two bones because you really don't want that cartilage rubbing together. First off, it reduces friction, provides lubrication because your bones are like a moving surface, and it prevents them from sticking together and rubbing that cartilage off. Another major function, what do we know about the blood supply to cartilage?
It's not very
Not
good.
good.
Not only is it not good, it's
Not at all. Avascular.
avascular,
Non-existent.
meaning there's no direct blood flow, right? So they have to actually depend on the synovial fluid for the blood vessels outside of that to innervate that, and then to have the nutrients and the gases and then all the waste and everything running through that fluid, and then the chondrocytes, the cartilaginous cells, getting nutrients and gases and getting rid of their waste through this fluid. Now, that's a very slow process, so if you actually damage your cartilage, what do you think? How do you think that would turn out for you?
Not good. It's
Have
hard
to
to get
take
back.
a long time to get back together.
Very long time, yes. Especially if you damage the cartilage, they would probably have to go in, do surgery, and remove the damaged portion, and just, hope that you don't really ever recover from that. But if you can live with it, they'll let you live with it. Sometimes you have to go ahead and have a replacement, meaning you actually get an artificial joint that is titanium. So you're kind of like the bionic man or bionic woman with that. Number 3, shock absorption. If you think about it, you have two bones that could be touching, but instead you have fluid in between them, so that when you run or even when you walk and you have that force, pressing down on the opposing bone, this actually absorbs that shock and prevents you from, crunch, and of course, as you get older, this can happen. Number 4, phagocytosis. In your synovial fluid, you have these cells, these macrophages, these big eaters, that if you have like some cartilage damage, they can kind of get in there and help clean up some of the tissue that's been damaged and everything. Just normal wear and tear on the joint, especially if you play football or some type of contact sport, you might have a bit of that going on. So in your synovial joint, you have things that we call accessory structures, okay? Now, accessory structures, you don't find all of these in all joints, okay? But one of the accessory structures is called the meniscus. Do you remember, what is the meniscus in chemistry?
It's
It's
like
that
the curve whenever you look at a cylindrical.
So
tube.
here, it's like, this is a 1 mil mark, and you have like the edge of it here, comes to the edge up here, you know that you're at 1 mil, right? Okay. So meniscus means crescent, because you're looking at that crescent shape of the meniscus to measure your fluids and all. And it is actually fibrocartilage, and it is a pad that you help that actually is wedged between opposing bones, and this is really, really helpful in the knee. It works a lot like if you know what a door stop is.
Mhm.
Like, it's kind of usually a triangular shape. It's kind of stuck under the door, and the door's not going anywhere. It really makes it more stable. Okay, that's kind of how your meniscus works. Of course, your knee is moving, but it helps stabilize it in different angles, so that, literally your knee is two bones like this in a synovial joint around it, and then you have tendons and ligaments and muscles that support it. So it would be really easy to dislocate, so the more of these things like the meniscus that you have to help stabilize it, the better. And that's why, what do you think one of the most common injuries in sports is? Torn meniscus, yeah. Of course, in the shoulder, it's the torn,
Rotator cuff or labrum.
right, okay. Now, labrum is a cartilaginous, yeah, okay. So anyway, this helps with a much tighter fit and stability. Okay. Another thing you have are called fat pads, okay? Now, fat pads sounds like something bad, but it's actually something good, okay? You have fat pads behind your eyes, why?
To keep your eyes nice safely in the socket.
Protection.
Protection, how? What's being protected?
The brain.
Yeah.
The brain, because right behind this little thin layer of bone is your brain. So between that thin layer of bone and your eye, you have this nice big fat pad. In case you get hit in the eye, you don't have to worry about it actually damaging the brain. So the same principle behind that is around these joints. They help provide protection, and you'll see some pictures here in a minute. They're kind of not in the joint itself, but they're around the joint and add cushioning and protection. And like if you want to get down on your knees, it kind of helps protect your knee and your joint. So it's very, very protective. Ligaments, of course we know that ligaments are a dense connective tissue and they have a very, very poor blood supply. So if you actually tear a ligament or strain a ligament, it's going to take you a really long time. Not as bad as cartilage. It's going to take you a really long time to get over it. Sometimes you never quite ever get back to normal. So the ligament is considered to be a thickening around the joint capsule. And again, these will cover the joint capsule in areas, and that helps stabilize and help reinforce and keep that joint strong. Also, the attachment, like I said, is so strong that it will limit rotation, which is a good thing, because you know, if you took your knee and it just turned around like this, ouch, you know, you'd be out of commission for quite a while. So you ever heard of having a sprain before? Okay, so literally what a sprain means is that you have a ligament that is stretched to the point where you actually have some tearing of your cartilaginous fibers. Now the whole ligament is not torn, but you have torn fibers, okay? So it's still functional, but you're gonna have swelling, you're gonna have a lot of discomfort associated with that sprain. So the ligament survives, the joint itself is not damaged, and these ligaments are so strong that oftentimes a bone will break before a ligament will tear. So actually I'd rather have a broken bone. Much
Doctors
easier.
say that all the time, and it's so confusing. They're like, "Oh yeah, you'd rather break an ankle than sprain an ankle."
Yes.
I'm like, why?
Yeah, and now you know why, right? Great blood flow to the bone, very poor blood flow to that ligament and tendon.
Like first, second,
And
degree, and like third degree sprains. Is that just like to the
The
degree
amount
of
of-
how many like the collagen fibers? that
Yes,
they
by the
torn?
amount of fibers that are damaged, right? Okay, well, I think we already talked about all of these. Okay, but there's a black and white version of a synovial joint. You also have tendons. You know, we mentioned that earlier. These again are not part of the joint itself, but they surround the joint, adding stability and strength to that joint. Again, just like the ligament, they usually limit the amount of rotation or range of motion. ROM is range of motion, and like I said, they are very supportive. Number 5, accessory structure, is a bursa. Have you ever heard of bursitis? Never heard of it?
Mm-hmm.
Ever heard of, I know you've never heard of that. Anyway, I'll give you some examples here in a minute. A bursa, be sure you know this, is a small synovial fluid filled sac, okay? It's actually lined with synovial membrane, so it has synovial fluid in it. Now this is located in several different areas. If you notice there's a colon here, meaning here they are. The main thing that its function is to prevent friction, okay? So any place where you could possibly have friction, meaning one thing rubbing over another, you're gonna have bursa. You actually have quite a few of them. So locations of bursa, that's the question, where skin rubs over bone. So think about your elbow and think about that. What is that bone right there, or that process?
Olkin process.
Olacron process. Right over that, you have your skin, and that's a lot of friction between the bone and the skin. So you have a bursa there. Between muscles and bones, another example, you have one like up in your shoulder, it's right in this area. And like my husband has one on one side that is very swollen. And he's like, "What's wrong? Do I have a tumor?" I'm like, "No, you have a bursa that's swollen. It's okay." And then muscles and bones, tendons and bones, and ligaments and bones. So, you know, anytime where you have friction occurring here, you're gonna have these bursa. So remember its function, it reduces friction, It also works as a shock absorber. Remember, it's a fluid-filled little pocket of synovial fluid. And it's gonna cushion that movement of one structure over another. So some examples of where you're gonna find the bursa. Here's your elbows. This would be the what? Right. And then right here is your bursa. Okay, so here's your skin, here's your bursa, right? Here's one up in the shoulder. You can see the muscle here, and then the bone. What bone is that that's this bursa's between? Or what structure is that?
Inclinoid fossa in the head.
The scapula.
Acromion process.
The acromion process of the scapula, yeah. So you have one there, and then here, this kind of green line right here, or whatever, gray, whatever, that's a bursa. So you have your fat pad here, you have a bursa, this fluid-filled sac there, and that's really gonna help decrease any friction there. And I think, yeah, here you have another bursa. So if you actually get on your knees on the floor, this bursa here will come into play a lot. And there's actually a condition where if someone is on their knees a lot, this will become irritated, and it becomes inflamed, it becomes swollen, and you have bursitis. It's called housemaid's knee. Okay, because used to, housemaids would get on their knees and get, the floor clean, or they would polish the floor or whatever, because they didn't have machines to do that kind of thing for them. So inflammation of the bursa is bursitis. It's caused by repetitive motion. So think about the motions of a tennis player, okay? Think about the motions of a baseball pitcher, same motion over and over. A golfer, same motion over and over. So these types of sports are really bad about developing bursitis in different areas. Also, if there's pressure over the joint, like I said, if you're on your knees, like cleaning the floor a lot, that can definitely cause it. This would be the housemaid's knee. Anybody in here, ladies, anybody that like to wear tight high heels? Yes? They are really bad for your feet.
I've never gotten a bunion though. I wear high heels.
Not yet.
But like, I'll wear them for like a good hour and then immediately take them off. So
Yeah, but there are women that wear like high heels all day
like
long.
24
Yeah, there's
hours.
some.
I could
I
not
don't
do that.
wear them every
Yeah.
single day.
The funny thing is, if you look at their feet,
They're like pointed.
they're gnarly. Yes, they're definitely shaped by those shoes,
Like,
and
women
they're
have
gonna have
pointed heels,
bunions.
It's literally Barbie. Like, Barbie's always like this.
Yeah.
She's like stuck.
Yeah,
Flat feet.
I don't know how women do it. I wear the comfort shoes. Anyway, the most commonly seen type of bursitis that you have is the bunion. You'll see that formed on the hallux. What is the hallux?
Heel, right?
No,
Big
heel
toe.
is your core.
Big toe. It is your big toe. And then typically, if you think about it, if you're taking your feet and you're cramming them into this little tight point of the shoe, you're having a lot of pressure on that big toe. And like I've had friends that had to have surgery for that. I had friends whose toes were like this from wearing high heels all the time, and they actually had to have surgery, and they put rods in their toes to straighten them back out. So take care of your feet. Your future self will thank you for that. Another thing too that hopefully y'all don't know too much about. So sometimes if you're in class, you might sit here like this and you're bored, right? So you're putting a lot of pressure where?
The elbows.
On the elbows. That is actually known as student elbow, when you're propping your head up with your elbows down on the table. And
I've had students.
that is a type of bursitis, okay? Now that is a really bad form of bursitis, but they can get very, very large, and oh my goodness, you see how red it is, how swollen? It is extremely painful. Yeah,
Like a whole extra like.
that's
What are they doing?
they're doing like that.
That's just, he's just
Yeah.
showing off his elbow.
Yeah.
Who has bursitis?
Yeah,
He did this for too long.
so if it became so extreme
Gotta
and
quit
so
doing it.
painful, what do you think might happen?
It would burst.
Well, usually before it would burst, what do you think they would do?
Probably
Drain it. Yeah. Take it out.
Or
Cut it off.
cut it out. Yes, they actually remove it. when it gets like that, because that is, I mean, it would take forever for it to
Drain.
and then, yeah, so it's really pretty
How does
painful.
like the synovial joint like? Is it fine without it after it's been cut out, or is that joint like just not like
Well, remember it's on the outside of the synovial joint, so it's actually not part of it. It's just a.
But it
kinda
does
little
help it
protection.
out.
Yeah, but without it, I mean, you'll still be okay.
You're still fine.
But yeah,
So it's not that serious.
yeah. So you
extra
lost a little bit of
synovial fluid.
protection.
Just yeah.
Okay, so this one you can't really tell it so much, but this area right here is really red and swollen. And remember the bursa that we said was up here, and you had one down here. This is the upper one,
Okay.
and that's the prepatellar bursitis. So again, very painful. Usually if you're playing a sport and you develop bursitis, you probably will not play that sport for a while. Because if you keep doing it, is it ever gonna get better?
No.
No,
I mean, eventually.
eventually, but not if you keep playing the sport, which is really sad.
Take up competitive games. Sweet spots.
Okay. Diarthroses,
Take up competitive games.
our synovial joints, we have 6 major classifications. Okay, we'll talk about each of these. You have the gliding joint, you have a hinge joint, pivot, condyloid or ellipsoidal, saddle joint, and of course the ball and socket, which you know a little bit about already. Okay, and these are all divisions of synovial joint. That piece of paper, I think. There you go. One more time.
We're at.
There you go.
That's embarrassing.
I think Ava threw it in.
Hey,
I
you
did not.
You
He
did. I
threw
would have
it.
heard
No.
you rip it.
No, you did. I literally have this and I just picked up the ground. He threw this back at me and I ripped one to throw it back at him, but I didn't do it yet. I was thinking about it. But I'm a good kid, so I did it. So my hand's still, see? Now I throw it at you.
And now you're not a good kid anymore.
Yeah.
Ah.
Dare you blame me,
You're
Tyler?
gonna take
I heard you
Not
rip a
me.
piece of paper out.
Because you just threw it at me.
Okay,
Bailey's
okay.
20.
just didn't do anything to say that.
So that's what I get for showing.
Some kid over here got a 20 on his study
Yeah,
guide.
you're gonna put 50 on another one.
Look, you got
And I know
this
it.
one,
He goes
though.
to church with me.
He like skipped a bunch of questions. He got 100 on this
Oh,
one,
that's bad.
They're just looking through some poor
You
kid's
never see
grades.
it. Always pay the best guess. Now, don't look at his papers,
Wait,
that's
that was
sad.
the guy. He played
gonna get
the
the
church
chance.
game.
No,
No,
I
this
took my
is
best guess.
Baylor.
This is Baylor.
Yeah, Baylor Oxford.
Yeah, he was. He escorted one of the freshmen.
Oh, that's it.
Olivia.
Yeah.
Okay,
Yeah, Baylor.
moving on, gliding joints.
He's a
Gliding
freak.
joints. Typically, you're looking at flat surfaces of bones, gliding or slightly moving across one another. It's very minor movement, you know, there's nothing major going on here. Very slight movement because you have a lot of ligaments that are going to be holding these bones together. For example, your carpals and your tarsals are great examples. You also have vertebral joints at the superior and inferior articular surfaces that are held together. Your vertebrae has tons of ligaments crisscrossing and, you know, stabilizing, because you really don't want to hurt your vertebral column because it's protecting your
Spinal cord.
spinal cord. Okay, all right. So slight gliding, slight twisting movement. You're going to find them here between your carpals, okay, tarsals. You also find it in the sacroiliac joint where the auricular surface is. You have a slight movement there, and that's going to be really handy for women, you know, during childbirth, right? The sternoclavicular and the acromioclavicular joints are also, again, slight movement, very, very little, but there is slight movement occurring there. Next, you have your hinge joint. What does that sound like, a hinge?
Like a
Like a
door.
Like a
Doors.
door, that's a great example, okay? Now, in a hinge, you have a convex surface of one bone fitting into the concave surface of another. So if you have concave and you have convex, okay, so you have a one plane movement. Typically it's considered to be flexion and extension. Flexion and extension. Now, depending on the shape of, like, the olecranon fossa and things like that, it definitely can allow you to also make a hyperextension. Ava, can you do hyperextension in your arms?
I don't know. What is that?
You
Instead
go
of being
further.
straight,
It's like, it goes like
Oh,
down.
Yes.
no, I cannot do that.
Okay.
But I have a friend who can. It scares me.
sometimes I'll have a student, Evan, no?
And Mitchell can
Okay,
do something weird with her
She
leg.
did like, their own, like, I've seen it.
yeah, it's
Oh my
very
gosh, Ada
unusual
Money
looking.
Maker used to have it with her.
She could go
No,
like-
she used to hit a high V, and she wouldn't be able to hit a high V because she'd hit it up here, and it'd be bent.
Bend her
And when,
arms.
like, she'd get yelled at. She'd be like, do a high V right. She's like, I'm trying.
Yeah, I was gonna say, there's nothing
That's
against the
kinda funny.
structure of your bones that dictates your function. So that one plane movement, extension, flexion, extension, flexion, okay, it's not rotating or anything like that. Some examples you'll see, tell me where this would be, interphalangeal joints, interphalangeal.
Phalanges.
So between the phalanges, okay? What about your humeral ulnar articulation? So your humerus, where's your ulna? Or here, okay, so that articulation, that's your elbow. What about the talocrural joint? Where do you find talocrural? Crural is like the shin portion, lower leg.
When it pops, what is that? 'Cause mine,
Here's what's
my
popping
ankle
over and
pops
over
every
again.
single
Well,
time.
Your ankle
your
pops?
synovial joints actually, some
Mine
popping
pop every
is not
single
abnormal.
You just did that.
Some popping is actually a buildup of nitrogen gas,
Dog
and
pops every
you can
time.
do that to release it. Yeah,
Well, I put
you're
my
popping
fingers all the
bubbles.
time.
I can pop this
Like,
one.
What's the
This
back kind
ankle
of
pops
popping?
every single time.
Where you actually have movement of a tendon or a ligament,
I put my fingers,
and
like, every
yeah,
day.
like, it might be displaced or something like
Pop your
that.
knuckles.
Yes.
But
Our
my
bone
mom
gets
tells me to
bone.
stop because
Wait, just
Made
popping your
knuckles
knuckles?
bigger?
no, she just
No?
told me to stop because there's something about
My back always
like
pops.
can't you get arthritis or something?
That's the myth.
Yeah, okay.
It's an old
Is
wives.
it-
It's an old wives' tale, is what
I
they
think
say.
that's how, what people used to say to get people to stop doing it
She
because
tells me to stop
it
because she doesn't like the sound.
That's what my parents told my older sister. They said you're gonna get
It's usually the
arthritis.
sound,
That phone.
and a lot of moms don't do that. Oh, don't do that because you'll develop arthritis.
Like
yeah.
I swear I can like write better when my fingers are popped.
A lot of people say
I don't
that.
like
If you think about it, in your
I just think-
synovial
I feel like
joint,
my
you've got,
fingers are looser.
if you've got
Yeah,
bubbles in your
technically
joint,
that's
it makes
right.
them tighter. So when you pop them, you're actually releasing those bubbles and releasing a
Bubbles
little bit of
out.
pressure off your joints.
What happens if you like pop it and like it hurts for like a little bit? Like,
Ah.
has that ever happened to you?
Maybe
Because
it
like,
shouldn't have been popped.
no, that's happened to me where like I'm like cracking my knuckles or
they're
whatever,
good
and for whatever
back
reason,
pops,
like one of them hurts.
Yeah, I can pop my neck.
There are
Like,
good back pops and
all
there are
the
bad
time.
Yeah, like there's a good one, and I try to do a good one, and then all of a sudden it hurts.
if
And
we
your
were
back
outside,
is like
I would've popped my neck.
in more pain than when you started because you tried to pop it. Because
Like, you
sometimes
go
popping
side
it
to
helps, but then all of a sudden you're in more
Sometimes you don't
pain.
completely
I
pop
always
it
pop
and it
my
hurts
back before I
worse.
tumble like
Is that what it is? You don't completely pop
It's
it?
like you partially do it and then
Like, I can pop my
your
back
muscle
like
goes
this.
into a little
my back
spasm.
and like my
and- yeah.
shoulders like that.
Because there are times where like I'll like flex my back because my back's hurting, you know, and hoping to pop it in a good way, and like nothing happens, and it just hurts so bad.
My friend can pop
Oh,
it.
I think
Time to go.
our
Oh, wow.
Like, he comes up-
Okay, last one, atlanto-occipital, where is that?
oh, that's between your head and your atlas.
The head and the atlas. So what movement do we make there?
Yeah, no, yes, movement,
Okay, time to stop.
oh yes.